But welcome everybody to the Mental Health Hour. Welcome to episode 84. This one is on suicidal ideation, a show we've been kicking around for a while. Obviously, not an easy topic to discuss or for some to listen to. So we want to make sure everybody is aware of what will be discussed tonight, and that it could be some difficult conversation. But you know how we do our show. We try and keep everything light and drama free and politics free, and without any unnecessary triggers. Now, suicidal ideation or suicide, the thought of, the talk of, the discussion of, in itself can already be a trigger. So we just want to be delicate with it. And if there's any issues, feel free to reach out to us or exit the stream if you need to. Because the fact of the matter is that in some way, shape, or form, everybody has been touched in some way by suicide, whether it be a friend, a family member, thoughts for yourself, some way everybody has had some kind of dealing with it. Gemma has more knowledge, personal knowledge of this topic than I do. As I've mentioned before on the show, I haven't ever thought about the ending of everything or doing it at my own hands, but we have talked about passive death wish and how that kind of struck home with me when I learned what that was. It was like kind of made a little sense, like passive death wish. You're not gonna do anything yourself, but if something were to come along, you're not gonna kind of step out of the way per se. Like it wouldn't be the worst thing in the world. These kind of thoughts are known as passive death wish, which is very different from living with the thoughts of wanting to end your life. So, Gemma, we'll throw over to you for a little intro kind of talk before we get into some information. And I do have a video as well that will help explain some of the prevention treatment is what they call it, prevention treatment, because it gets into a lot of CBT, DBT, which is we've touched on in the show, but Gemma and I are in no way experts on. But anyway, Gemma, if you want to start us off with whatever you feel is best, you want to kind of touch on anything.
Okay, so it's timely as this one because it was actually the anniversary of the first time I was admitted to hospital with having tried to take my life. It would have been on Monday, and I was 9 when I started self-harming, but I would have been about 14 or 15 when I really ramped it up and ended up in hospital having my stomach pumped and everything. Definitely not pleasant. Continued to do it, actively wanting to die. Didn't want to be here, and tried many, many different routes and things to try, to the point where I even looked it up to see if there was ways of doing it quickly. I've noticed now, It certainly wasn't back then, but now if you look anything up like that, it plasters the entire Google search with all mental health helplines, crisis lines, because it seems to pick up on what you're searching. So if you're starting to search that stuff, you're going to get a load of helplines come up. Or certainly that's what's happened when I tried it the other day, not to look because I wanted to do it. I just wanted to see what did come up because it had been mentioned before. And then, like we mentioned with the passive death wish, that's something that I have struggled with more recently. And that was like things from like, I'm prescribed these medications, I ain't taking them. If it kills me, it kills me. If it don't, it don't. To sometimes putting my music in my ears and I will just walk. Don't look out. Don't like if something's coming, it was meant to be, kind of thing. And that took a lot of trying to get out of. That's actually harder, I think, because once you're in that mindset, it's really hard to switch it off. Whereas to actively go and try and take your life, you're physically having to do something yourself. I found that when I was hell bent on doing things like that, I didn't tell anyone because I didn't want stopping. But sometimes I would tell people, not because I think that I genuinely intended to do it. I think that was more of a cry for help at the time. But yeah, I've done it. What, I'm 39 now, so 30 years worth, more or less.
Right.
It makes me more aware of the signs and things to watch out for because I know Thomas, when he was having cancer treatment in the early days, he told me that he wanted to die, and they ended up sticking a NG tube up his nose because he refused to take his medications. So I'd had to put him in when he was asleep because he was like having none of it. Luckily, it didn't last very long, but I think because of my experience with it, it makes me more concerned, and certainly with internet and social media and things as a child, teenagers especially, it's harder for them because there's so much more pressure than when I was a child. I didn't have the internet and peer pressure and bullying to deal with. And I think a lot of, like I've seen on other platforms that are renowned for short videos and live broadcasting, is there's been an awful lot on there, an awful lot of bad publicity on there because of the pressure that certain people put on others and doing challenges and things, and it ends up fatal, pretty much.
Yeah, and that's just one aspect.
Mm-hmm.
I mean, these challenges. I didn't even think about that as part of tonight. But yeah,
Well,
there are a lot of social media. Well, I mean, there's a lot of social media peer pressure
mm-hmm.
on most everything these days, but even suicide or the thoughts of and that kind of thing is not exempt from.
Mm-hmm. Yeah, the
Which,
latest one that I saw that claimed the lives of quite a few, Blackout Challenge, which was an actual attempt
yeah,
to.
that's been around for a while too.
Yeah, it's come back again. Not that long ago, because there was a child, he was 11, hospitalized with it over here, and they were stem cell dead. And it must have, like, I remember seeing it and seeing the parents saying, but he's breathing, the chest's moving and stuff. And to have to explain, actually, it's the machine that's doing that. That must have been devastating. But
Mm-hmm.
so many other stories of children having taken their life because of peer pressure online.
I've run a lot of calls on the ambulance or fire engine for that matter because they both get dispatched to um, a potential cardiac arrest scenario where somebody could be pulseless or unconscious.
Mhm.
Um, just for the engine comes along for manpower in case we have to do CPR and all that good stuff. Um, we need more hands, so that's why you get a fire engine on those kinds of calls as well as the ambulance. Uh,
Okay.
but I've run several suicides, attempts, um,
Mhm.
things like the challenge, the pass out challenge. We get called for stuff like that. Uh,
Mm.
it's not always devastating, of course, but there have been quite a few in my career where um, we have to deal with the fact that somebody has done this, and the family has found them, or
Mhm.
um, it's just maybe a welfare check type scenario, and that's what has come to be. Um,
Yeah.
so I mean, we you talk about things like suicide or the idea of it, and for those that have, I'm going to lean on you for this one.
Mhm.
For those that have gone through those thoughts, uh, does it weigh on your mind the after effects of, who's going to find me,
Oh.
this, that, and the other, and if it does, do you just kind of
Mm.
compress that, or
So, like sometimes no, not at all. Like when I got that bad, but I would often try and make an attempt to do it out of the house rather than in the house where my family lived. But yeah, very much. One of my attempts was I was stood over a motorway bridge and I was gonna go down, and all I could think of was, what if it's a car? What if some car hits me? Who's in that car? Is it a family? Is it going to ruin their life? Will they ever be able to drive again? Am I going to cause an injury, or am I going to cause a multiple pileup? And that on that occasion was enough for me to stop doing it because of the guilt that I carried with that thought. But when I say I've tried many different routes, it isn't like, it's definitely not an exaggeration. And a lot of what I did, I had planned around making sure that I wasn't found necessarily by my family, or like in the home where they had to live, so that they didn't have memories of me dead in that room, um, because that did weigh a lot on my mind. And a lot of people think it's like a cop out or it's weak to do that, but the absolute mindset you have to get into and the sheer amount of, I guess, willpower to want to do that and not carry on. Because believe me, it really isn't easy to take a knife to your own wrist or something.
Mhm.
Like, and to actually do it, sometimes just seeing the blood was enough for me. It was just that instant ouch. And I don't know if this is going to make sense to anybody, but a lot of the time when I was hurting the most, it was more about taking that pain from like in here and in my heart and physically putting it somewhere else. So for that moment in time, the ouch I had caused, say on my wrists or whatever, hurt more than in my heart. And then because it became obvious to people what I was doing, I became more sly about doing it and then took to my tops of my legs and things like that so nobody could ever see. Because I didn't want that and I didn't want to be carrying that around. And I'm kind of glad in a way that I did that now, because I have, obviously, I'm here. And to see those scars, like I can see them now. And it does remind me a lot of those things that I went through. I know
Yeah.
when I went to a group therapy, a lot of people cover them up with tattoos and things, and that does seem to help people. And one of the ladies that was there at the time said that she got tattoos of, like, positive tattoos of her kids' names and
Sure.
things on them, because it would be enough to stop her self-harming there, because she'd have had to cut through, say, her daughter's name or whatever, and that she
I
said
mean,
help.
that's certainly a good idea as
Mhm,
far as what can we do to help prevent. Um, and that's one of the things I want to get into tonight is uh, how we can help in suicide prevention.
mhm,
Um, and there's multiple different resources. It doesn't have to be a monetary thing, uh, but I mean, there's all kinds of walks for suicide awareness and prevention,
mhm,
um, and meetings and stuff that you can get involved with. It's nationwide here. I'm sure it's worldwide. I don't know if the one that I'm specifically thinking of is called Out of the Darkness Walk, and they do walks for suicide prevention
mhm.
and raise money, raise awareness, and that's at least nationwide. I would assume it is worldwide,
I'm just gonna look it up real quick and see if it's called the same thing.
but at the same time, we can also look at prevention in a way of preventing yourself from succumbing to the thoughts, the voices, the pain. Um, Hattie says, I took a call at work once as I answered the main phone. Sheriff was called to speak to a lady I work with. Her daughter came home from school and found her dad passed away on the floor from self-inflicted head wound. Had to help the lady calm down before she drove 30 minutes home. That's the call taker. Or that's but yeah, I mean, that's one thing that we deal with in the field as well when we run these calls on the ambulance. Um, it, it's not just the patient, the patient's family's there, and now they've essentially become patients of ours as well because they're not in a state of normalcy at that time. Shock sets in. Um, some people I've seen pass out. You know, they've I've just there's been a lot of different reactions, and the way we react and our body reacts might warrant a trip to the hospital for them as well.
Mhm.
The stress of the situation alone can send the heart into backflips and what have you. Um, so there's a lot going on a scene like that. It's not cut and dry. Uh, However, the um, law enforcement, I saw Michael Joseph Murray. There, lots of time, law enforcement arrives before fire and EMS. Um, they are also put on these calls in case it's a crime scene. So they are dispatched as well. Even if we run a cardiac arrest uh, for at a nursing home, say, for grandma who's 90 and was on was expected, and she passed away overnight or something, the
Mm,
police are still called. Any death warrants law enforcement response in case there's a crime scene to be processed, because there are times when it may seem like it's cut and dry, passed away in your sleep, this, that, or the other. There's
mm.
actually a crime scene there, and something unnatural happened. So anyway, that's just addressing that comment there on why you get police response on that as well.
Mm.
Um, but let's get into a couple slides here. We'll go over some information, hopefully spark some more conversation. Because I know tell everybody here about calls I've run till
Mm.
the sun comes up on this subject matter. But that's not really gonna get the necessary message I hope to that we can present here across. So Gemma, if we can start by getting a little informational bullets on like
Yeah.
warning signs and what we can do.
Yeah. So on this one is the warning signs. So talking about feeling hopeless or having no reason to go on living, making a will or giving away personal possessions, exhibiting reckless behaviors such as excessive alcohol or drug consumption, avoiding social interactions with others, expressing rage or intentions to seek revenge, and appearing anxious or agitated. Just one thing that I'd pick up with the avoiding social interactions, that can actually be the opposite way around as well. Because when I thought I was going to end it, I got in touch with everybody that I cared about just to tell them. So if it comes out of the blue that you end up getting a message or a call that seems overly nice and like,
And that can
yeah, that could also be them saying goodbye, which is what I did.
so
Uh,
yeah, and you can see some warning signs. Now this is just 6. We've got some more on the next slide, but this is just 6 for
mhm,
a good talking point here. If uh, if you'll take notice, some of those warning signs are very clear and concise and to the point. Talking about feelings,
mhm,
uh, making a will, or giving away possessions. These are like you can see these from a mile away. Um, Basically just talking about the act of it, or telling somebody I've been thinking about it. Okay, now we have something to go on. Not always the case though. If you see avoiding social interactions, that could be just depression.
mhm,
Expressing rage, or intentions to seek revenge. uh, when when's the last time you have dealt with a coworker or a friend who has wanted to seek revenge because they're getting messed with or something, and your
mhm,
first thought was, this guy is in trouble, he's having thoughts of suicide?
mhm,
Or the same goes for anxious or agitated. Like, people, their anxiety is in everybody, so they're not all cut and dry. I guess the point I'm trying to make is, we hear folks say all the time, when a tragedy like this occurs, it's our first thought is, man, if only I had seen or done more. It's not always that easy. They might have been showing their signs, their warning signs, in a very cryptic manner. And then, of course, some people do just outright talk about it, or just start filling out wills. These folks are more than just contemplating it. They're getting they're getting the ducks in the row. Moving on to the next slide, though, we got some more warning signs and risk factors.
yeah. So on this one, so we've got quite a few more things now. So warning signs, talking about wanting to die or to kill oneself, searching for a way to kill oneself, talking about feeling hopeless or having no purpose, talking about feeling trapped or being in unbearable pain, talking about being a burden to others, increasing the use of alcohol or drugs, acting anxious, agitated, or restless, sleeping too little or too much, withdrawing or feeling isolated, and displaying extreme mood swings. And then risk factors, so things like a family history of suicide and or child maltreatment, previous suicide attempts, history of mental disorders, particularly clinical depression, history of alcohol and substance abuse, cultural and religious beliefs, e.g., belief that suicide is a noble resolution of a personal dilemma. Isolation, a feeling of being cut off from other people. Barriers to accessing mental health treatment. So loss, like relational, social, work, or financial. Easy access to lethal methods. An unwillingness to seek help because of the stigma attached to mental health and substance abuse disorders, or to suicidal thoughts. Yeah, a lot of good points on there, but as you've just said before as well, a lot of those would be also tied to depression and anxiety.
You could, well, for the warning signs at least, yeah. Like, again, sleeping too much or too little. That is that's symptomatic of a lot of things. Depression being one, insomnia. Um, it doesn't always, we don't want folks watching this broadcast and then saying, well, my child is sleeping 18 hours a day. He or she must be having terrible thoughts. That's not always the case. These are
Mhm.
just a collective um, list of warning signs. Now, like sleeping too much, that is a warning sign of depression or a symptom of depression, and
Mhm.
depression could lead to the thoughts of. Um, so take these with a grain of salt. The risk factors, I think, are more beneficial to look for.
Mhm.
Um, these people reach out for help, um, and sometimes they're blockaded um, or cut off from resources. One mentioned there on the risk factors side, barriers to accessing mental health treatment. This is
Mhm.
something we talk about a lot with insurance agency or insurance companies. Um, our benefits don't always provide the best coverage for mental health related resources. Um, that is turning around and it's
Mhm.
becoming better, but it's a slow trickle down. Not everybody. I was just talking with a friend who does not have um, coverage for mental health related resources,
That's
um,
great.
and there's just these barriers, um, especially also the unwillingness to seek help. That's a self barrier. The unwillingness to seek help because stigma attached with mental health. Um, you're blocking yourself from getting any help because you're just afraid of who's going to think poorly of you or um, whatever might be going through your head about not wanting to be put into a certain group of people
Yeah.
that need constant attention or what have you. The stigma that we all know
That's
that.
just happened to me recently because Thomas at the moment is very clearly suffering with depression and I'm trying to get him some help. But prior to that, all I could think about was if he gets labeled with any sort of mental health problem and he has any physical condition later on in life, then he's screwed. Because I personally, we have an NHS, so mental health technically is free. However, the problem I have is I'm too high risk for one of them because I have actively tried to end my life. The other side of it is because I'm not currently trying to end my life. They won't entertain me either. So I'm right in the middle. So the only thing I could do is say, yeah, I just tried to kill myself if I want that mental health support, which is ridiculous. But when it came with Thomas, I didn't want him labeling because I knew that later on in life, if he ended up with any physical problems that isn't textbook, like the conditions that I have can be hereditary, if he ends up with one of those, then it's going to be a fight for everything. Because every time I go to the doctors about my physical condition, they say, "How's your mental health? Shall we look at that?" And I'm like, "No, I didn't come for that." And it just makes you feel so like dismissed and like nobody's hearing you, no one's listening, no one cares. So I'm like, well, why would I bother then? So I don't actually go and tell my doctor when I feel like crap because they would just dismiss me of it. So it's awful that in 2023 we still have such stigmas and problems with it. You're muted, Tim. Hang on, is he muted? Or is it?
Oh,
Yeah, you're muted.
was I muted? I'm sorry. It's not going to get any better, is what I was saying.
Mm.
The stigma itself, and wanting to get um, or be classified. Craig says, "I don't like labels anyway. People try to live up to them, and that can make things worse." And that's true.
Yeah.
Labeling people or putting them in quote unquote groups or cliques or
Mm.
you know it doesn't do anything good for anybody's mental health for that matter.
Yeah.
Molly said earlier, our insurance only allows for 8 hours of mental health therapy a week, or I mean, I'm sorry, a year.
A year? Oh my god.
8 hours a year. That is 8 1-hour sessions with a therapist, for instance. If you go, most folks see a therapist once a week.
Yeah, I used to see
Or
one.
if you're into, or I shouldn't say most folks do this, not everybody goes to a therapist. Folks
Mhm.
that go to therapy
Mhm.
usually go once a week.
They say that's what helps if you are having these sort of thoughts. That's what they recommended I had once a week, 1 hour once a week.
So you think about it, that's 1 hour every week. There's 52 weeks in the year. That's 52 hours. She's getting coverage for 8 hours. And that, I guess, out of pocket for the additional, 44 hours? And that's not cheap. So things are coming around with it. It's going to take a little while, but I am seeing progression, at least in my coverage, my insurance coverage. Let's go to some five action steps. These were coming up frequently when I was looking for some material to put on
Mhm.
the screen tonight. Action steps for this kept popping up.
Yeah. Okay. So, action steps for helping someone in emotional pain. In 2017, suicide claimed the lives of more than 47,000 people in the United States, according to the Centers for Disease Control and Prevention. Suicide affects people of all ages, genders, race, and ethnicities. Suicide is complicated and tragic, but it can be preventable. Knowing the warning signs for suicide and how to get help can save lives. Here are 5 steps that you can take to be the one to help someone in emotional pain. So, number one, ask, are you thinking about killing yourself? It's not an easy question, but studies show that asking at-risk individuals if they are suicidal does not increase suicides or suicidal thoughts. Sometimes if they like really watch them when they're answering as well, they're not just because no is coming out of their mouths, usually there's something there's you can tell, I think. Well, I have been,
Absolutely,
yeah,
absolutely.
might say no, but really look at how they're saying it.
Yeah, you can read people. Um,
Mhm,
there's definitely tells and signs to the
mhm.
people's. It's no different than talking about anything else, and you can see their face change. You know.
And another really, really big telltale sign, just something that I would do, check if they're always wearing long sleeves, particularly in warm weather. Check that out. Um, Number 2, then, keep them safe. So reducing a suicidal person's access to highly lethal items or places is an important part of suicide prevention. While this is not always easy, asking if the at-risk person has a plan and removing or disabling the lethal means can make a difference. Number
then number
3, be there. Listen carefully and learn what the individual is thinking and feeling. Research suggests acknowledging and talking about suicide may in fact reduce rather than increase suicidal thoughts. Number 4, help them to connect. Save the National Suicide Prevention Lifeline number, or whichever is relevant for your country.
Yes,
In
we
your
do have a comprehensive list for you.
Yeah. So when you need it, it's there. You can also make a connection with a trusted individual, like a family member, friend, spiritual advisor, or mental health professional. And then stay connected. Staying in touch after a crisis or after being discharged from care can make a difference. Studies have shown that the number of suicide deaths goes down when someone follows up with the at-risk person, and that is very true. When
Yeah.
I had a voluntary section many years ago after I tried to take my life, and I agreed to go into hospital, because if not, I would have ended up sectioned anyway. But I agreed to go into hospital, and I was in for quite a while. And coming out of what was a safe environment back into the big wide world, shall we say, that was really daunting. And I think that a lot of people, when they come out of that safety net into the real world again, that's when they're probably most likely to struggle. So if they know that there's somebody there checking up on them, making sure that they're all right, it makes you feel more, I guess, wanted, validated, and it does help. It really does.
Yeah.
From coming from someone that's been there, done that, I promise it helps.
So just remember the action steps: ask, keep them safe, be there for them, help them connect, and then stay connected with them.
Mm-hmm.
Helping them connect may be, I think, one of the most important ones on there. They're all important in their own way,
Mm-hmm.
but helping somebody connect with some help or resources that they can use for help is by far one of the most helpful things that you could do for I know, this is speaking from experience as well, not necessarily in a suicidal sense, but with anything mental health. I needed help reaching out for help with my drinking, or I wasn't going to hear anything else about it. I had my own thoughts, and that I was set in my ways. I needed the help, but I also needed to want the help.
Mm-hmm.
So let's go forward to how to identify if your pain is psychological in nature.
Okay. So this one, it's how to identify if your pain is psychological in nature. Psychological pain manifested in the form of physical bodily pain is termed as somatic pain. Signs and indications of somatic pain, so tension or pain in certain body parts, such as headache or pain in the limb, which mimics a physical pain, but no medical reports suggest or support the physical reason of pain. No medications seem to relieve the pain. Physical symptoms, bodily pain, elevated after stress, tension, or emotional trauma. And then handling physical indications. If the pain is persistent, then firstly, visit the medical doctor, who may recommend some of the suitable required tests. Supposedly, the doctor might suggest a CT scan for severe headache. If the test reports show a normal result and the pain persists, While no pain reliever is effective, then there is a high time to address the psychological nature of a physical pain.
Right. So um, I threw this one in here, and there's more to it. We don't have to exactly go through the other three as in depth, but it's an interesting, and I'll put these slides in the Discord as well, so you can take a look at it. It's an interesting uh, set of. Let me throw the other one up here real quick. That it's an interesting thing to think about, that they can kind of look the somatic pain. Um, is something that I suggest researching. Um, the it kind of shows how you're in pain, but it's not always physical pain, but it can what's the fucking word? It can present as physical pain sometimes,
Mm-hmm.
and that's just the brain at work. You know, the receptors and the synapses firing, saying, "Hey, I need help." Um, the only way it knows how, and that's to create physical pain. Because what do we want to do when we have physical pain? Go get looked at, right?
Mm-hmm.
So there's interesting things coming. And I'll just read the conclusion real quick. The above mentioned facts are generally not accepted by the person who suffers from a somatic pain disorder. By reading the detailed article, you are now more aware of your internal pain symptoms. Hence, if you find any somatic symptoms in yourself or among people who are near and dear to you, then just visit a psychologist for detailed insight. Uh, it's something to think about. Because we're talking about all these risk factors and signs and symptoms, and not everybody presents in the same manner. Well, somebody that is experiencing some physical pain for unknown reason, this could be something to definitely follow up on.
Mm-hmm.
um, your ankle, or I'm just pulling that out of my head, your ankle shouldn't just start throbbing because, or without you having rolled it or sprained it or something. uh,
Mm-hmm.
there's something more to it. It needs to be addressed. So that's basically what this was all about. Nail driver, good to see you. He says pain is registered in the brain, and the brain is just trying to send it out and uh, get it. Hey, we need help in here.
Mm.
That's what your brain does. It recognizes an issue, and it's trying to get your body to recognize it. Um,
It's difficult with this though, because like, yes, that definitely does affect it, and I've been there experiencing physical pain because of my mental health. But also, I certainly hear.
yeah.
That's why I mentioned about Thomas. If doctors can't find an immediate textbook problem to the pain you're having, they like to diagnose things that would suggest that.
Hmm.
And like, it's literally autoimmune month this month anyway, autoimmune awareness month. And a lot of autoimmune diseases can cause physical pain that isn't really picked up on, such as an x-ray or anything. It can be something underlying which isn't immediately visible via, say, an x-ray or a scan, and it's not until you get further into it with blood works and everything else that it's like, oh yeah. But it's a hard one. It depends. I've certainly struggled with getting doctors to listen to pain that is really there because of conditions I have, and then pain that is brought on by mental health. And it
Right.
is true, mental health can cause physical pain, and I have had it a lot,
Yeah.
especially
It's
when you're so stressed as well, because you.
it's definitely a real thing that the brain does, and that's just the brain reaching out, trying to get your attention that something's effed up.
Yeah.
Tony, how are you? Tony D, good to see you.
Hmm.
And Eric J Gaming, thanks for the 11 months. Um, Happy to have you guys in here. Um, let's switch gears um, and talk about helping someone. We have kind of been, but focus on it. Here's a couple of things, and Gemma can read off for us um, to think about. And then we do have a little video that will explain more in depth on some of the actual psychological prevention.
Okay, so this is some tips to helping someone deal with suicidal thoughts. So, having an open discussion can lighten his or her burden and prevent piling of negative thoughts. Ensuring that she is not alone and as much as possible can avoid buildup of isolated feelings. Being compassionate can give the assurance that she is not alone and that their endeavor, like we mentioned it on a previous broadcast, not to be dismissive of their like feelings, understand and accept it, and that really goes a long way. Acknowledging her feelings can motivate the afflicted to share their pain more often. So yeah, that's what I just mentioned. Uplifting his or her mood by dropping a random message can boost their confidence and morale. I'll just swipe that a bit. There we go. Not allowing her to get in touch with negative triggers can minimize stress or anxiety. Encourage them to follow a healthy lifestyle can bring back lost confidence. Keeping things like knives, razors at bay from them can minimize the risk of self-harm. Tracking record of her treatment can help them to attain successful recovery. And motivating them to seek professional advice can convince them to opt for one. So some good tips there.
And these are obviously, you have somebody that has reached out now. We're not looking for warning signs anymore. The motherfucker has come to you and said, I am having these thoughts and I don't want to do this. Help me. You're getting the clear-cut message. Now, how are we going to respond to that? We don't want to. One thing I would like to go back to is that slide about staying connected. This isn't a one day, let's talk, let's chat, let's have a cup of coffee. Are you feeling better now? Great. We'll see you tomorrow. And then never talk to them again, or never follow up. Perhaps even put others on the radar. Get some more of your social group involved. Get your friends in. Their friends involved, their family involved, and their doctors, if they have some. These are just some tips or thoughts to consider for somebody that has reached out, and that happens. I mean, people do reach out because they don't want this. Much like my drinking, at times I was like, I don't want to drink today. It makes me feel like shit. I don't want to go through all of the trickle down from what one day of drinking brings, more depression, hangover, etc. And my body feels like it's shutting down. I don't want, and then I'm still 5 minutes later in the kitchen getting a beer or something, because sometimes we can't overpower that addictive thought, or our brain is far more powerful than our will.
Very much so.
That's one of the things they taught us in rehab, is that willpower is bullshit. If you're doing something solely on willpower, then it's almost always doomed to fail. And that's just, that's not, I'm not putting that out there so you can argue with me. I do this with sheer willpower. That's great. Not everything that we say, or pretty much everything that we say, It's not going to be the same for everybody. But for the vast majority of addicts or somebody having strong thoughts that they can't get rid of, willpower is bullshit. And it's not, you need more help than just willpower.
Mm-hmm. Yeah, to suicide and things. Like, I remember once sat with a knife in the kitchen, and I'd been looking at it for ages and doing the, like, between the fingers, Russian roulette or something.
Yeah.
Doing that, and I kept putting it away and like, no, not gonna do it, not gonna do it. And it's like, as much as I didn't want to keep going there to take away the pain from in here and put it somewhere else,
Mm-hmm.
it felt like I couldn't control what my hands were doing anymore, and my body was acting out what
Yeah.
my brain was saying, and I had no control whatsoever.
Yeah. It's
of-
like you're in a different state. It's like, you could be saying internally, I don't want to do this all you want, but your body's still moving forward and doing the action that you don't want to do. And it's
Mhm.
just, it's insane
Like
how
watching yourself in a
that shit
film or
works.
something. Yeah, like, it's
Let me,
really.
let's do this, because we're approaching 7 on the Eastern Shore. Let's play this video and then we'll talk a little bit about that, and then we'll start wrapping things up.
Mhm.
Because I did want to play this. It does explain some things that we're not necessarily going to be able to get across in a way. So hopefully it's only like 4 minutes. So give this a watch and we'll be back to discuss.
I don't want to live anymore.
I can't stop thinking about suicide. I've thought about it for years.
I've made 3 suicide attempts, and I don't know if I'll be safe tonight.
I just drink enough so I can stop thinking about killing myself. I hate thinking about it.
These are the voices of suicide. They are the voices of people in despair who don't know what to do about their thoughts and who might do something dangerous. We know how to help people with these thoughts, and we know how to help people turn away from dangerous behaviors and towards something that can provide them with the help and hope they need. There are several evidence-based treatments that help prevent suicide attempts. This means that they have been proven to be more effective than other kinds of therapies in reducing suicide attempts in people who need this help. 3 of the most effective are dialectical behavioral therapy, or DBT, cognitive therapy for suicide prevention, or CTSP, and brief cognitive behavioral therapy, or BCBT. The proof that these treatments reduce the chances for suicide is very strong. DBT, CTSP, and BCBT share some common goals and activities. Safety. The beginning of treatment starts simply by figuring out what people can do to manage what they are thinking and feeling during a crisis. Sometimes this is called a safety plan or a crisis response plan. Each safety plan is unique and individualized. Managing hard feelings. Sometimes people feel powerful, negative emotions, and they don't know how to manage or cope with how intensely bad they feel, which is when thoughts of suicide emerge or grow stronger. Treatments help. People learn ways to care for themselves when the thoughts and feelings are the worst. This can be done using relaxation, mindfulness, or distraction techniques. These are skills a person learns during a time when they are not in distress, so that they can effectively use these skills when they are feeling really overwhelmed. Changing what you do. People often develop their own ways of coping to try to manage how badly they feel. Drinking or using drugs, isolating, avoiding work, eating poorly, or generally not taking care of themselves can all be examples of things people do when they are feeling bad, but that we know don't work well. The good news is that new skills can be taught and acquired to give people skills to better manage their feelings. Changing what you think. People who experience thoughts of suicide often become hopeless that things will never change. Sometimes these thoughts can be triggered by something simple, but spiral out of control. These 3 treatments all focus on practicing, paying attention to, and changing these types of thoughts. Staying well. After people begin to feel more hopeful and develop some new skills to manage these thoughts, they practice ways to effectively and quickly respond if suicidal thoughts and behaviors return in the future. Thinking about suicide is scary, and it's hard to know what to do. But those thoughts and behaviors can be targeted, treated, and changed. DBT, CTSP, and BCBT are each effective treatments that focus directly on suicidal thoughts and behavior. They can help people to improve and find hope.
All right. Just a good video, I thought, and I wanted to share with or on the show here towards the end about prevention and treatment. And I think that, after doing this episode and coming across that video in particular, I think another episode on this would be warranted. I'd like to go just solely into prevention therapy, or prevention treatment for suicide. So we'll look into definitely doing that coming up here in the near future. But I mean, what stuck out, if anything, to you there, Gemma?
They're just the treatments and things, I guess. The different types and how it can help. There was one, was it BCBT? I'd not heard of it. Called that. But
so that's we've done 2 episodes on CBT, cognitive behavioral therapy. That's just another kind of branch of it. BCBT, DBT is also a branch off of it. That's dialectical behavior therapy. Our show that we did a long time ago now on radical acceptance is DBT in action. So what I will do is I will put all of the slides, as I always do, and this video on the Discord. And I will post a few articles that I found on CBT or BCBT, DBT, and hell, I forget the other one. Something ST. But I will get those posted in our Discord. And I might even send them out on some of the socials like Twitter. Just for further research, personal research, if you'd like to get more information. If you know somebody, if you are somebody or you know somebody that is experiencing these thoughts and have reached out for help, please report this information to report that. Obviously help them find the necessary resources, but also don't just keep it a secret. Reach out on your own for help for you. If somebody were to come to me with this particular circumstance, reaching out for help on suicidal ideation, I would help them, obviously, but I would not shoulder the load. And by that, I mean, don't keep it a secret from everybody and think you're going to be the only one that's going to get this guy through this. Because, well, there's a couple things. That's not something that should be handled by one person and one person only. You need to reach out to resources for help for this person. They need psychiatric and psychological help, therapy, intensive therapy sometimes.
Mhm.
That's not something I can provide myself, but I can get you in touch with folks. And also think of it on the back end. If you don't succeed in helping this fella or lady, now what's that do to you? If you haven't reached out and got, if you're trying to shoulder this on your own,
Yeah.
now your mental health is in the trash because you think you just killed this guy or gal.
Yeah.
You
Very
didn't do what you didn't do everything you could, and you're going to now shoulder the blame. And that's not right either.
No, and you can't be there for someone 24/7 anyway, because you're just going to burn yourself out completely.
Absolutely.
So another reason why you can't do it by yourself, because you can't be there for them 24/7, and then when you start burning out and having to take time for yourself.
But it does happen, and it's quite a natural feeling that you can navigate this by yourself. But the fact of the matter is, it's not a good idea for many different reasons. And that was one thing I wanted to kind of wrap things up with. Reach out for help. Jeeves, good to see you. With that being said, though, we'll get into our show wrap up. Let's start looking at some community calendar. Of course, as I said, if you need more help, we have the comprehensive list of helplines available for just that. Reach out, use the helplines, and let us know if you want us to add any as well. Like we might not have a certain number that you're in need of. I think Gemma knows more about that stuff than I do. But you can always reach out to us in the Discord and what have you. Catalyst tonight, our good buddy Jim in Chicagoland does his Wednesday night broadcast that we promote here on the stream. Please join us at 10 p.m. Eastern, 11 p.m. Eastern. I was listening to Ray plug it on his show last night, and he's like, I don't fucking know when he goes. I don't either anymore. It's sometime in the 10 o'clock hour we go live, or he goes live for Catalyst, and it's a good time. Speaking of Ray, there is his handle as well. Give him a follow. He did his show last night. It was awesome. Great quotes at the end of the year, or at the end of the broadcast, and good positive stories and good vibes all around. Eric is in the chat as well. He's a former guest of the show. He streams every Monday night. Give him a watch and a follow, please. And then Gemma, my co-host, has her very own Twitch channel. She does do more than just the mental health hour. She does some cooking, some baking. And you have something actually you want to promote right now, don't you?
Yeah, well, I'm doing some cooking on Saturday, 7 o'clock UK. You've all altered your clock, so there's only 4 hours between us at the moment. So it'd be 3 p.m. Eastern on Saturday. But yeah, me and Meg are doing a ab sale. I was meant to do it last year, but Thomas was taken to hospital the day before. So I'm down doing a free fall ab sale down something that is, I think it said 262 feet high. And I'm terrified of heights, so fun times. That's in May, 13th of May. If you are able to sponsor us, it was on the thing, but bio.link/Thomas Fight12. It's all on there. And then there you go, Ella and Poppy, Penelope.
What?
I said Poppy. I don't know where that came from.
Penelope's here. She wanted to come say hi. But yes, for all things bunny, we got our good friend Ella, the bunny mom. I was just talking with her the other day, and she's doing well. Shop's doing well. Everything's going well. So please keep showing her that love and support from us, and send her a follow, a share, and a like on all of her bunny saving needs. Let's see here. Penelope, she is getting big. She's getting big. aren't you? They're talking about you.
Rosy cheeks, bless her.
That is it for tonight.
Live Q&A. You keep forgetting to mention it.
What?
The live Q&A.
Oh, thank you. Damn it. There it is. This will be coming out this week. Actually, probably right after the damn show. I'll put this out on the socials. We've got the Mental Health Hours live Q&A 5, number 5. There's a QR code attached. You can scan, send us in a question. We'll answer it live. Please remember, as we have in the past, we've never really had an issue with this, but keep them clean, keep them mental health related and not offensive.
There's a couple I've not been able to read out, but mostly they're fine.
Yeah. So we're excited to bring this back. It's one of my favorite shows to do because you just get to go in so many different directions. So, no, Penny's not talking yet. She's dad-dying and cooing and all that good stuff. She does say dad, but like she's not. That's
when you want her to, though, right?
That's the only real word that you can make out in her repertoire right now. Did you teach her to swear? No. No. All right, guys. With that being said, we're going to get on out of here. We'll see you guys back here next week. Keep your eyes on the socials for more information. And please join the Discord as always. It was good chatting with everybody tonight. And we'll see you on the next broadcast. Bye for now.